There you are. Kevin Zhu, University of Toronto, breaking the wall of peripheral nerve regenerator.
Thank you. Every muscle that twitches in our body, every sensation that we perceive, from the touch of a hot stove to the crunch of an apple, is transmitted to and from our brain by the peripheral nervous system, a rich interconnection of large and small nerves that arborize throughout our torso and our extremities and serve as electrical impulse conduction highways. Unfortunately, peripheral nerve injuries are common and can result in a disconnection of these electrical highways. Oftentimes, when the two nerve ends are cut, they can be surgically stitched together, but in the most severe circumstances, there is a gap between the two ends and a nerve graft is needed to bridge this gap and then be sutured together. Fortunately, nerves regenerate innately. However, this process is extremely slow, and by the time these axons individually grow through the nerve graft and towards the end organ muscle or sensory receptor, the muscles can often atrophy and become irreversibly degenerated. And the resultant action is that people are paralyzed and they're no longer able to be meaningful contributors to society. So in our lab, we have been investigating multiple methods of enhancing peripheral nerve regeneration. And one of the most promising is electrical stimulation briefly for 1 hour at 20 hertz at the time of surgical nerve repair. Electrical stimulation serves as a jump-starting technique that allows the body to regenerate these nerves more efficiently and result in earlier muscle recovery. Now, we have built on previous investigations of electrical stimulation done in animals and also shown in clinical trials that result in earlier recovery of muscle function. And you can see here from this graph that compared to rats that had only sham or fake stimulation, rats that received nerve grafts with electrical stimulation had significantly more motor neurons that regenerated at the study endpoint. And similarly, when we look at the individual axons within a nerve, we can see that compared to unstimulated or sham-stimulated rats, rats that received true electrical stimulation at 20 hertz for 1 hour at the time of nerve repair had significantly more myelinated axons. Now, why am I here today? Well, we know that despite multiple North American clinical trials and decades of animal experience that electrical stimulation is effective for enhancing nerve regeneration, it's not widely used because this is what the device that we use to stimulate looks like. It's heavy, it's bulky, there's too many controls, and it's not user-friendly. In order to promote our knowledge and translate it beyond the lab and beyond North America to surgeons worldwide, we need a streamlined, user-friendly device that is easy to operate. And we need to break this wall. And therefore, we need your support, the Falling Walls program, so that our patients can benefit. Thank you.
Thank you, Kevin. You were very fast. You would have had an extra 10 seconds. Of course, we started earlier, but you did that. You arrived on the dot. Thank you so much. Could I ask the jury for questions? So, Sophia, you're first.
Yes, thank you. My question is, do you have any ideas what this device would look like? Have you been working on that?
Yeah, thank you for your question. So the device that I showed in the photo is what's been used in animal studies and clinical trials. You can see it's very heavy and bulky. There's a lot of controls. What we're envisioning is something handheld, like a Game Boy or an iPhone-sized device that could potentially be sterilized and used multiple times, or even disposable. And it would be preset to have the settings that we need. So the 20 hertz and the 1 hour timer, instead of twiddling dials back and forth and flipping switches up and down, you'd have an on and an off button.
Thank you. Second question. Ben, please.
I would guess to develop such a device, you need a lot of technology and a lot of investment. Who would be potential partners? Because you probably cannot develop it on your own. Do you have any idea who could be potential partners?
Yes, I think there's three groups of people. We need engineers who can help build the device. We need pharmaceutical companies that know that there's a market out there for people with nerve injuries and who could benefit. And then we need surgeons who are invested in the product and in the evidence that shows that it works to be early adopters.
And time's up.
Thank you.